When patients come into our office, they're oftentimes very nervous and scared. That's very normal. We have needles, we have drills, and so it's not most people's favorite place to be. So we offer sedation. A couple of different ways that we can sedate you include nitrous oxide, which is just a mask that fits comfortably over your nose, and it's very safe. I use it on my daughter. She's 9. It can be used on kids and adults alike. And the nice thing about nitrous oxide is that you can drive to your dental appointment. So you can drive yourself here, you can drive yourself back home because it's so safe and it's effective. But as soon as we remove the mask from your nose, you're right back to your normal self. So there's no lasting residual effects on your body. But it does provide that light sedation that will make you more comfortable while you're having your work done. So for patients who need a little more sedation than what we can provide with the nitrous oxide, we provide oral sedation. And this allows you to sleep during your dental appointment and to feel really relaxed and comfortable. It is a pill that you take an hour prior to the visit. You do need someone to drive you to and from your visit, but it can relax you and make your procedure much more comfortable. I do recommend oral sedation for patients who are having surgeries done, like implant surgery or multiple extractions, anything that you do need to be a little bit more comfortable with, like those longer surgeries. It can be a very nice way to make the experience safer and easier for you and more comfortable.